Good morning, everyone, and welcome to today's webinar hosted by PYA, the CARES Act, your piece of the $2 trillion pie. PYA is a leading professional services firm providing expertise in healthcare, tax, management consulting, and audit and assurance. We are pleased to offer you our thought leadership on this important topic. All attendees have been placed in listen-only mode. You may submit written questions using the question pane of the control panel. Our presenters will address as many questions as possible during the Q&A session at the end of the webinar. If we cannot answer all questions due to time limitations, we will supplement the transcript to this webinar with written responses. Please be aware, with more people using online platforms, outages can occur. Should the webinar be paused, we will work to restore it as quickly as possible, and all of our webinars are recorded and released after the event. With that, I'd like to turn this over to David McMillan.
Hello, everyone. Thank you for being here today. We're excited about presenting a lot of information to you. We're going to do our best to get that completed within the time frame we have allowed. But note that we are available for follow-up via email should you have questions we're not able to get to during this time. I quickly want to remind you that, Matthew, if you would advance the next slide. I want to remind you that your presenters today, Marty Ross, who is the managing principal of our Kansas City office and works within our strategic planning service line. Marty also is the thought leadership editor for our firm, so much of the content that you see hitting our website has been edited by Marty. And then I'm David McMillan. I serve as the firm's chief financial officer, but I also serve as the managing principal of the consulting practice at PYA. So in response to this pandemic, there have been 3 significant pieces of legislation that have been passed. You can see those on the slide on the screen. The first being passed on the 6th, $8.3 billion in emergency funding to federal agencies. The second being passed on the 18th, which had to do with sick leave, testing, and other issues. And then finally, what we're here today to talk about, which is the CARES Act, signed into law just last Friday. $2 trillion of relief. Important note there at the bottom, prior to the passage of the CARES Act, the federal budget was approximately $8 trillion. So the $2 trillion represented about a 25% increase. Stated differently, the new $10 trillion federal budget, the CARES Act, is about a 20% of that total federal budget. As we all know, the irony of this pandemic has been its significant impact on our healthcare providers as it relates to their revenue and funding sources. So obviously, what Marty will be going over in just a moment with respect to payments that can be received through the federal government for providers, what I'll be covering first related to the SBA loans has particular importance to many healthcare providers, many of whom are probably listening in on this call, who have interrupted cash flow as a result of either the discontinuation of non-emergent procedures or the general reluctance of the public to continue to see their medical providers. And so we're starting to see news from all over the country about how our provider community, who have been and will continue to depend on to help us through this crisis, are suffering. So here's our agenda for today. We're going to start off with the Paycheck Protection Program, which is really the relief funds to small businesses. Then Marty's going to jump into the Medicare advanced payments and the Public Health and Social Services Emergency Fund. And if we have time, we'll get into the 4th agenda item, the other healthcare related provisions. As I mentioned, there's a lot here, and as always, we'll be posting this webinar online for on-demand access. So with that as an introduction, let me get into the Paycheck Protection Program. A lot here to unpack. We've already received some questions we'll try to get to, but there's likely no way we'll get to everyone's question. So 349 billion in small business loans. So a couple things to note here. This is being provided under the Small Business Administration Section 7A Guaranteed Loan Program, which is an existing loan program. That loan program, however, is being utilized for these new PPP, Paycheck Protection Program loans. Just some quick facts: the loans are up to 10 million. The loans must be received before June 30th. There are no SBA fees with this, which is an interesting development and something that, again, points to Congress's desire to ensure that there are no prohibitive expenses associated with these loans. And the next bullet point is particularly important. There are no collateral or personal guarantees required, which is different than existing 7A program types of requirements. And finally, you should note that the SBA will not take any recourse against individual shareholders, members, or partners of businesses that obtain these loans, so long as the proceeds are used as allowed, which we'll discuss here in a minute. So the fact that these loans are non-recourse are also is also a very nice attribute of the loans. Now, obviously, as we'll talk about in just a moment, the fact that the loans have a forgivable portion is certainly what most folks are interested in understanding better. So let's talk about who qualifies for the loans. I want to point out to you on that second bullet point that, as opposed to other SBA loans in the past, nonprofit organizations do qualify for this, but it is important to note that nonprofit organizations have to be both 501c3 and 501a status organizations to be able to qualify for the loan. I'm not going to read the listing there to you. You can see it for yourself, but I am going to point out that last bullet about companies defined as small businesses in the SBA Act. There's some specific direction provided in the SBA Act that will that should be noted in terms of who's eligible for the loan. But generally speaking, we're talking about employers with less than 500 employees. Now, in this sense, an employee is defined as anyone who is part-time, full-time, or some other status under their employment with the borrower. I would note to you that as we wait for additional clarification from the administrator, there will be likely some guidance provided as to many of the specific attributes that we're going to talk about throughout the next 15 or so minutes together. But this last term about part-time, full-time, or as otherwise employed may fit into that category of needing some further clarification. So just note that we know there will be some clarification coming, and as I'll speak to in just a moment, that clarification is expected by April 11th. I want to get that out on the table quickly so folks understand that the law provided for the administrator to provide clarification within 15 days of the law's passage. So we're looking for that to come from the administrator by the 11th. We'll be looking to our 7A loan processors to help us with that. Last bullet point on this page, and just important to know, you've got to the businesses that would qualify have to have been operating on February 15th, 2020, and you had to have already been compensating employees or contractors to be eligible. So right now we're just talking about eligibility. So who makes the loans? Currently authorized lenders who participate currently in the SBA 7A program that opt to participate can make the loans. So one of the things you may want to do is speak with your financial institution to find out if in fact they are currently a 7A lender and if they are opting in to participate in this program. Now, it's interesting, this sub-bullet point tells us that other financial institutions may also be qualified during this process. So it's important to note that even if you contact your financial institution and they say, well, we're actually not currently qualified, they may be qualifying in the future before the loans are made available, or certainly before the expiration period. So you want to talk to your financial institution. Kind of reversing one bullet point here, the SBA will not be charging a fee for this, but the lending institutions will be getting paid for their processing as they typically do now. And in addition, there can be, some of you may choose to seek out somebody like your accounting firm or others to help you with this process. Those fees are separate from the SBA fee itself. A couple of things here at the bottom that this slide that we want to make you aware of. You do have to make good faith certifications that you're going to use the fund to retain workers and to maintain your payroll, or make other allowed payments, which we'll talk about in just a minute. So the point is, you can't obtain these funds and then use them for purposes outside of their intended purposes. And then finally, I just made mention of this, but I want to make mention of it again. It's really important, and that is we're expecting to receive the guidance from the SBA no later than April 11th, so that we know what's next. And why is that important? Before I get into slide 9 here, let me just say a couple of things. Number one, if you go to the SBA site today, you're likely first going to see what are called the EIDL, or the Economic Injury Disaster Loan forms or processes or application pages. If you search within that SBA website, you'll actually find the existing 7A loan forms. Now, a couple of things that I would caution you about. Number one is there are some 7A loan forms on that website that are actually out of date. So if you want to look at what a 7A loan application might actually look like, then what you probably need to do is make sure that you have the correct form. We do not know right now which forms will be required. We know the administrator has made it clear, and Congress has made it clear, they want to expedite this process. So all of the forms that are listed now as being a requirement of a 7A loan application, if you want to know what those are, go to the website. We're going to tell you here at the end of the presentation a few things you'd likely want to be aware of. But I would also tell you that that's likely a conservative listing of what's going to be needed. Chances are you're actually going to need less than that. Now, we don't know that for sure, but we do know that it was the intent of the Secretary of the Treasury, and it was the intent of Congress to expedite this process. Expediting the process doesn't generally equate to requiring more forms. So we suspect that some of that will be excluded once we get the actual guidance from the administrator. But all of that is to say, if you do want to go out to the SBA website, look for the current 7A forms, see what's out there and what's available. Those are published for you. Don't get it confused with the Economic Injury Disaster Loan Program. That is a separate program, which we'll talk about in just a minute. So now back to the Triple P program. So if we look at the Triple P program, and the slide that's on the page right now, how much can be borrowed? This is a lot different, as I mentioned just a moment ago, from the Economic Injury Disaster Loan Program. Some of you may have already applied for that. We'll talk about it in just a minute. But that loan program has a $2 million cap on it. As you can see, the Triple P program has a $10 million cap. Now, as you think about what you're going to qualify for, it's the lesser of 10 million or 2.5 times what's listed there on the page, the average total monthly payments for payroll costs. And you're looking at that average monthly amount for the 1 year before the date on which the loan is made. Now that's in quotes because that comes right out of the law. In reality, you don't know when the loan's going to be made. So what we would tell you in terms of initial guidance is be calculating that as of now, assuming that you're going to make application sometime within the next month or two. I would update it for each month that's available prior to the month of your application. So you're going to be looking back 12 months and looking at average payroll costs over that 12-month period. So now your natural next question is, well, what are payroll costs and what am I looking for? And so all of these terms come directly out of the law. You're looking at salaries, wages, commissions, and then you can see there in quotes or other similar compensation, not defined beyond that. Again, I won't read all of these to you, but there are some things to be aware of. Separation payments are included. Group health care benefits and premiums are included. We already received a question from one group that was self-insured for their health care costs, and they had looked at their average monthly payments. They had looked at all of their various fees and funding requirements and taken that average over the last 12 months, which I think is an entirely appropriate and logical approach. But again, it will be something that individually you would want to discuss with your 7A lender if you have some specific questions. Next to the last bullet, payment of state or local taxes assessed. That does not say payment of federal taxes assessed. So note that any type of federal taxes that are included within your payroll are not a portion of this computation. You can also include compensation or income of a sole proprietor or an independent contractor for amounts less than $100,000 on an annual basis within that calculation. And then finally, you need to know that there are a number of things that are not included as eligible payroll costs. So any individual employee, just like that contractor number on the last page that was limited to $100,000, any individual employee whose annual salary is in excess of $100,000, you're going to cap them at $100,000 for the purpose of making this computation. You can see that the law specifically referenced 3 chapters of the Internal Revenue Code. We've provided those here for your convenience, 21, 22, and 24. So you can't include any of those taxes in your computation. And then anybody whose principal place of residence is outside the United States does not qualify. That next to the last bullet point is pretty important, and that is, as we talked about the previous 2 pieces of legislation that had been passed, obviously one of them being the Families First Coronavirus Response Act. The credit that you're able to take for the family leave wages associated with that piece of legislation are also disqualified for purposes of this particular loan. Bottom of the page, if you received an economic injury disaster loan between March 31st and March 27th, then that loan may be able to be refinanced into this new Paycheck Protection loan. 2 comments I'll make here. One, the language within the law is a little confusing on this, and I think there's, after speaking to a couple of 7A lenders, there's even confusion among the lenders about this. Secondly, as we get guidance, I think that we will want to ensure that we have a better answer, collectively on that as well. So once you get the loans, you've made application, you've made your computation, you've multiplied it by 2.5, you know what you're eligible for, it's something less than $10 million. Once you get the loan, what do? What can you use it for? Well, even though the loan only qualified using payroll costs, you can actually use the monies for more than just payroll costs. Now, remember, you're making a certification earlier, though, that you want to maintain your payroll as best you can. So you can see here on this page the things that also qualify as allowable expenditures for the loan proceeds. And down at the bottom, there is a specific provision within the law that references other allowable uses, working capital uses as expressed in the SBA Section 7A loan documentation, most of which is covered here, but I would at least draw your attention to the fact that there may be some specific matters that are included in that definition that aren't here on the page and weren't specifically referenced in the law. So linger there for a moment so you can see all of those payments. And I would, I guess, draw your attention to the fact that if you did incur some debt prior to February 15th of 2020, then interest payments on a mortgage or interest on debts occurred before that date are allowable uses of the loan proceeds. So now we get to the kind of the really key aspect of this particular program, and that is what can be forgiven. And so we've got sort of two things here, and the first component of what can be forgiven is what the loan proceeds are spent on. So as long as you spend the loan proceeds on the allowable listing that we discussed on the previous page, and this is measured over the 8-week period following the loan origination date. So you get your loan, you're measuring for 8 weeks. What amount did I spend, and did I spend it on these things? Then you're getting to the first part of your equation, which is how much of the loan that I received is forgivable. Note down there at the bottom, your forgiveness amount cannot exceed the principal amount. And really important, it's kind of two pieces of good news. Not only can this loan be forgiven, but the forgiveness portion is not subject to federal income tax, So it does not count as income for tax purposes as you think about your business's tax return. And so now we look at the reductions. What are things that would cause your forgiveness to be reduced? You can actually have a decrease in your employee wages individually, but that decrease can't exceed 25%. So everybody that's making less than $100,000 a year, you can actually have a decrease in the wages if you needed to for purposes of cash flow preservation and helping your business to continue to make it through this bridge period. But those reductions have to be 25% or less. And this next one's an important point too, and that is you do have the ability to sort of get a pass on folks that you may have previously laid off prior to February 15th, but you're actually able to get rehired by June 30th. Again, there's some specific, and we'll wait for the sort of the loan forgiveness documentation to come from the SBA. But I think what the legislation is trying to recognize here is that some of the businesses had to take, including many people on this call, may have taken action prior to the announcement of this legislation, and they want to be able to allow folks to recover from that action, get the loan proceeds, and actually still qualify for some forgiveness despite that action that occurred prior to the legislation being passed. So once we know the amount on the left-hand side that is available to be forgiven, then we multiply that amount by the quotient determined by this formula that's on the right-hand side of the page. So you're looking at the average number of full-time equivalents per month that are employed over the roughly 2-month period following the receipt of the loan. It's important to note here that the definition of FTE here is different than the definition of employees that constitutes the 500 employee maximum. So these are full-time equivalents, okay? The law doesn't, as currently authored, doesn't go beyond saying FTE and defining that as full-time. So there may be some additional guidance we get from the administrator on that, but don't look at this particular equation and equate FTE to employees on the qualification for businesses with respect to the 500 employee threshold. So we're looking at the average number of FTEs per month employed over the roughly 2 months following the receipt of the loan, and you divide that by one of three denominators. If you're not a seasonal employee, then it's, you're not a seasonal employer, then it's really just one of two denominators. You're either going to divide that by the average number of FTEs per month that you employed from February 15th of 2019 to June 30th of 2019, so kind of doing a 1-year look back, or the average number of FTEs per month for the 2 months at the beginning of this current calendar year, 1/1/20 to 2/29/20. So you have a choice as a borrower as to which one of those denominators that you use. So I've said earlier, the forgiveness portion is kind of twofold. You determine the amount that's eligible to be forgiven, and then you multiply it by this quotient. And as a borrower, you're obviously going to choose the denominator, A or B there, if you're not seasonal, A or B, that gives you the best quotient. Remembering you can't be forgiven more than 100% of the original principal. Seasonal employers have to take this February 15, 19 through June 30, 19 measurement date. So for the amounts that are ultimately unforgiven that you're going to need to pay back, it's a 10-year or maximum 10-year repayment period with a maximum interest rate of 4%. You can pay it off early, and there is a 6-month minimum deferral on this. So from the time you receive your loan proceeds, to the extent that you aren't able to qualify for 100% forgiveness, the amount that's unforgiven, no payments due on that until 6 months after the loan origination date, and can be extended for up to a year. That guidance has not yet been received to tell us how we would get those additional 6 months. So what do you need to be doing right now? Right now, what you ought to be doing is beginning to determine your loan eligibility and your amount. So how many employees do you have? What are your average monthly payroll costs? We gave you previously in the slides the definition of what constitutes a payroll cost for purposes of making the loan. You definitely want to speak to a 7A lender. So I mentioned that earlier. Talk to your current banker, see if they're a 7A lender. Go on, besides that. You also want to start looking at the documents, as I mentioned earlier, that are that are required as part of the 7A process. We said this will likely be streamlined, but you will probably need some financial statements, probably 3 years of tax returns, and then of course these two SBA loans, 1919 and 1368. And I've already commented on that bottom bullet point. Don't look at the out-of-date loans. Real quickly, there's been a lot of conversation about the EIDL, or the Economic Injury Disaster Loans. These are a separate loan program. You can apply for that on the SBA website. These are up to $2 million, waiver of personal guarantees for smaller loans. These are typically loans that are obtained by entities that are unable to obtain credit elsewhere. That is not the case with the PPP program. You do not have to sign a waiver saying that you were unable to obtain credit elsewhere. Another attractive component of the PPP program. And I've mentioned the fact that these EIDLs might be refinanced, but again, I would caution you to ensure you speak with your 7A lender to know whether or not your current loan can be refinanced and how it may or may not affect your forgiveness. If you have not yet entered into an EIDL, you can still do so. But again, work with your 7A lender because you have to ensure that you aren't double dipping for the same purposes on the loans. And then finally, in the law, there is a provision for an advance or a grant of $10,000 that you can get within 3 days of application. This does not have to be repaid. So just be aware that you have the ability to apply for that advance under the law. So that is a really breakneck sort of overview of what has been provided through the law under the Payment Protection Program. We'll be available to answer questions. Our contact information is listed. We have a team of people that have been stood up to help in that regard and help you get through this. So know that we're here for you if you've got questions or if you just need help getting information pulled together and talking with your lender about the applicability of this program for your business. So with that, I'm going to turn it over to Marty, and she's going to jump into some of the payment provisions of the law.
Thanks, David, and good morning, good afternoon, everybody. We're going to start talking about the new Medicare advanced payment provisions. This is the most immediate available solution for providers that are facing significant cash flow challenges. Congress took a very limited program that provided accelerated payments of Medicare funds and exploded it in the CARES Act. For hospitals, IPPS, Children's and Cancer Hospitals, you're going to be eligible to receive an advance equal to 100% of payments for a 6-month period. Critical access hospitals get a sweetener. They can get up to 125% of that 6-month period payments. All other Part A and Part B providers may receive up to 100% of Medicare payments for a 3-month period. Interestingly, if you read the statutory language, it only addressed hospitals' ability to secure advance payments. On Saturday, CMS published its program instructions with regard to this advanced payment program, and it expanded that option to include all Medicare Part A, Part B providers. We published today on our website an article that summarizes these key components of this new program if you want to take a little deeper dive into this information. Who's eligible for this program? You had to have billed Medicare some claim within the last 180 days. You cannot be in bankruptcy. You cannot currently be under active medical review or program integrity investigation and not have any outstanding delinquent Medicare overpayments. If you can meet that very low threshold, then you have the ability to make application to receive advance payments. That application process will be administered through the Medicare administrative contractors. And they have been directed in the program instructions to post the forms on their websites. So an hour and a half ago, I worked my way through all of the different MACs websites. I found one that had a current form now posted to its websites. Others were giving instructions to their COVID-19 hotline, but be sure that you're able to access the correct information on your MAC website. I assume they're going to be updated regularly here in the next couple of days. They also are required to maintain a COVID hotline so that you can call in with any questions regarding this advanced program. The required information here, very, very simple. Your basic identification information, the amount that you request based on your calculations, and the reason you are making the request. And the instructions say that check box 2 regarding advance payments due to the COVID-19 pandemic. It then needs to be signed by an authorized representative and submitted by email. Yes, you can submit it by snail mail if you want to. It's simply going to slow down the process. The MACs are required to accept these applications over email. We have here an example of a form I referenced previously from Novitas that they've updated to match this guidance. You can see it's very simple, 1 page, very basic information. In fact, they ask, do you want the full amount or some lesser amount as your advance, not even requiring you to actually do the calculation yourself. The approval process, very basic. MAC confirms that the form is complete and that you meet the eligibility requirements. They'll then notify you via email that you are in fact entitled to receive the advance and that you should receive payment within 7 calendar days that you make the request. Again, this is probably your fastest and quickest way to secure dollars to maintain cash flow during the pandemic. Of course, it's not free money. There is a recoupment process and a reconciliation process. So for the first 4 months, there is no offset on any of your Medicare claim submissions. You'll continue to receive payment as you did. Beginning on day 120, the MAC will begin to withhold payments up to the amount of your advance payment. So the idea here is that you expect that you're going to have continued slow payment because of a reduction in your elective procedures. You take the advance, it should cover you through that period. Then once you begin submitting claims again, it will offset the advance that you received. Then after a period of 1 year for hospitals, 210 days for everybody else, the MAC will make a demand for payment equal to any outstanding amount following the completion of the recoupment process. So from after 4 months, you're going to have a period of recoupment that will last a year if you're a hospital, for another 90 days for all other providers. After that recoupment, whatever amount is left that has not already been withheld, the MAC will make a demand for payment. Interestingly, there is an opportunity under typical overpayment rules for an extended repayment schedule, which involves interest. We're not certain how the MACs will handle these direct payment demands. There's nothing in the program instructions that CMS published that address this. And also there's questions regarding the impact of bankruptcy. If you're unable to pay, will this be a discharged obligation? It's still an open question for this going forward. So there's some back end rules that will certainly need to be developed around this. And of course, remember, Congress retains the authority to make any extensions to this program it deems necessary as our experience through the pandemic continues to go forward. Other point I would make here is that this is not a limited pile of money, that these opportunity will continue to be available through the emergency period that is declared by the president. So it's not necessary that you run and get this money first. There's no limit to the dollars that we made by advance overall to all providers. Next, we want to talk about the Public Health and Social Services Emergency Fund. This is new dollars that have been infused into the healthcare system to help them address the demands of the pandemic. This fund is administered by the HHS Assistant Secretary for Preparedness and Response, and its FY19 budget was about $2.6 billion. And through the fund, the ASPR, the Assistant Secretary for Preparedness and Response, a new acronym for you, ASPR, currently administers these programs primarily through grants. Interestingly, in 2019, the National Strategic Stockpile was moved from the CDC over to this fund. And so the stockpile now resides within the ASPR jurisdiction. So these are the types of projects that this fund has been utilized for over the last several years. The CARES Act and Title VIII invests some significant new money into the fund, to say the least. First, there's about $275 million that remains available through FY22, but actually the fund is instructed to redirect that money to the Health Resource Services Administration, HRSA, both for funding for the HIV/AIDS program as well as rural health initiatives. Those are simply maintaining current levels of fundings through 2025, through 2022. Then secondly, the fund received a $27 billion allocation that will be available through FY24. This is intended for the fund to secure vaccines and therapeutics, diagnostics, otherwise develop surge capacity for responding to the COVID epidemic, as well as in that $27 billion, the fund is instructed to spend up to $16 billion to replenish the national strategic stockpile. Finally, and probably what you are most interested in, is the I forgot a zero, the $100 billion now available through the fund until expended. These funds are available to reimburse providers for healthcare-related expenses or lost revenue that are attributable to coronavirus. That's language directly from the statutory provision. The statute also states that these funds cannot be used to reimburse expenses or losses that could have been covered by a different source that's obligated to cover those expenses. So you've heard this fund, this new $100 billion fund, referred to as the Marshall Plan for healthcare providers. First thing to keep in mind is this has been generally reported as a fund available to hospitals, but in fact, the statutory language is not limited to hospitals. It is any provider that is involved in diagnosing, treating, or caring for individuals with possible or actual cases of COVID-19. So it has broad coverage available. Eligibility is not based on being a hospital. What the statutory language requires, and by the way, it's a whopping 568 words of statutory language that establishes and directs this new $100 billion fund. But the language does require that the applicant will submit an application that includes a statement that justifies the need for payment. Interestingly, there is then language in the statute that in the discussion of the application states that this funds shall be available for building or construction, buying properties, buying medical supplies and equipment, new PPE, to increasing your workforce, providing training, creating emergency operations centers, retrofitting and developing surge capacity. So very broad in terms of what these dollars are available to be used for, but that language doesn't capture what's earlier in the statutory language, which refers to the coverage for lost revenue. So we'll be looking for guidance very quickly out of the Assistant Secretary as this fund is stood up and funds begin to be, the application process is developed, exactly what can be claimed in terms of securing these grant dollars for covering lost revenue. Again, remember, now we're talking grant dollars that don't have a loan component to them. These are available, new fundings available in the marketplace. Most concerning, I believe, is the language that says that the Secretary will approve applications on a rolling basis and make payments from the fund on a rolling basis. In these 568 words, there is no funding criteria. There is no preference given, that 5 out of the 100 billion, 50 billion to go to hospitals or 20% needs to go to rural facilities. There's no language like that. It's simply all healthcare providers are eligible for this, and it is up to the Secretary to decide how that money will be distributed. And it does appear that this will be a first come, first served basis. So one has to begin appreciating what potential expenses and potential costs in the future will be necessitated for this type of funding now. HHS is directed to distribute the funds in the most efficient manner possible to provide emergency payment, which presumably would forgive many of the federal requirements around grant applications and grant review. There is a requirement that if you are a recipient of these loans, you're going to have to make regular reports and maintain documentation as required by the Secretary. And finally, HHS is instructed to provide written reports to Congress every 60 days. That's the best we have in terms of a time frame for HHS and the Assistant Secretary standing up this new process, that they have to report on the distributions made within 60 days of passage and then every 60 days thereafter. And remember, we've got an agency now that, like us, are all working remotely and are now challenged to stand up this new process. So stay tuned, stay aware of where this opportunity, when the doors open up for applying for these grants, be prepared as best you can to identify what your expenses are now so that you can be prepared to pursue that money. Again, grant monies, not loan monies. Okay, in our last 15 minutes here, we're going to go through other healthcare related provisions in the CARES Act. Remember, this is an 880-page piece of legislation. In fact, there's no summary available through Congressional Digest on this legislation. Many of these provisions were added literally at the last minute through the negotiations between the House and Senate leadership. So some of these are not yet well scoped out, but we can at least appreciate where the opportunities are for you. Beginning with Medicare sequestration relief, you know, since it's amazing to believe it's been almost 10 years now that we've been subject to this automatic 2% reduction in all Medicare payments imposed by the Budget Control Act. For the period of May 1 through December 31st, CMS will no longer apply the sequestration reduction. In effect, it's a 2% across the board increase in Medicare payments. Now, one question not clear from the language is whether the sequestration relief will apply to the date of service or the date of submission. Certainly, if it's date of submission, that creates an incentive to either want to hold claims or resubmit claims that you can get that 2% increase, but hopefully we will see guidance coming out quickly from CMS on that particular point. Of course, nothing free here. To pay for this particular provision, Congress chose to extend sequestration through FY 2030. That's no surprise. Congress has been regularly extending sequestration as a somewhat of a budget gimmick. But at least now we know in the immediate future, you'll see this 2% increase. One question that remains open is what happens with the Medicare Advantage? The language of the statute is such that Medicare Advantage plans, which have also seen a 2% reduction in the payments they receive from CMS. The question is, how does that translate to payments made by Medicare Advantage plans to providers? The instruction I can give you at this time is look at your contracts with Medicare Advantage plans. Most have been amended since 2011 to address this issue of sequestration and reduction in payments accordingly. But you should be certain as, you know, this is the right time now before this actually goes into effect to figure out exactly what the impact is going to be with your Medicare Advantage plans. Next up, in the CARES Act, Congress delayed the impact of the Medicaid dish cuts once again. If you remember back around Thanksgiving time, when we had one of our emergency funding bills for the federal government, it included at least a 5-month delay in the impact of the dish cuts. They were expected to go into effect on May 23rd, that there would be $4 billion reduction here in federal fiscal year 20. And then we were scheduled for $8 billion reductions each federal fiscal year from 21 to 25. In the CARES Act, Congress has eliminated the FY20 reduction. It has instead pushed that forward to FY21. So beginning December 1st of this year, you'll have the implementation of the first $4 billion in dish cuts. And then going forward, you'll continue to have the $8 billion reduction from FY22 through 25. Here, Congress did not push it out a year. It effectively cut off $8 billion in the planned dish cuts because it did not include adjustment for FY20. Oops, sorry, next slide. There we go. Next financial advantage offered in the CARES Act to hospitals concerns the DRG Payment Adjustment. So any discharge you have of an individual who is diagnosed with COVID-19 during the national emergency, in effect, your DRG payment will be increased by 20%. Unclear if you have a patient that is discharged following the end of the national emergency, whether that payment will also be adjusted, sort of inexact language in the statute. We do know that if you've got, regardless of what the DRG is, as long as one of the primary or secondary diagnoses listed on the claim form is COVID-19, you're going to see a 20% kick upward in that payment. Unclear whether that will cover Medicare Advantage plans. Again, language is not specific, but one would expect that type of DRG adjustment would be pushed on to Medicare Advantage plans at all. For critical access hospitals, reimbursed on a cost basis, it's just to highlight that certainly the increased costs you're experiencing as a result of COVID-19 is an opportunity to do an interim rate review. Again, submit that through the MAC process, make sure you're getting a proper adjustment so you're not waiting 18 months for your cost report adjustment to cover those increased costs. The CARES Act also included some additional expansion in the Medicare telehealth benefit during the national emergency. Now, as part of COVID-1, the original appropriation, Congress amended Section 1135 of the Social Security Act to provide the authority to the Secretary to provide emergency coverage for telehealth beyond the geographic and location restrictions that exist in Section 1834M of the Social Security Act. So PYI did two webinars last week covering both the technical aspect of this telehealth waiver as well as the practical implications of the telehealth waiver. Both those webinars are recorded on our website if you want to access that information. But there are some other important changes that were part of the CARES Act that sort of cleaned up a few issues remaining from that earlier congressional action on March 6th, which at this point seems like 3 years ago. Most importantly, it now provides that rural health clinics and federally qualified health centers will be able to submit claims for telehealth services. Up to this point, telehealth has not been an RHC or FQHC covered service. The directive in the legislation is to HHS is to create a payment rate similar to the national average payment rates for comparable telehealth services. So this will not be reimbursed at the RHC or FQHC visit rate. It will be an adjusted payment. And it also notes that your telehealth costs will be excluded from your calculation of both your PPS calculation for FQHCs and your adjusted interim rate calculations for RHCs. So that's probably the most significant change for telehealth that's made in the CARES Act. But also the legislation finalizes that permission for providers to waive cost sharing for telehealth services. OIG had issued guidance that it would not pursue any enforcement activity against providers who chose to waive those, but now we have congressional authority that actually permits that waiver. Congress also corrected that coverage for telehealth services will expand to new patients. Again, CMS had indicated that they would not pursue enforcement activity nor do claims review to determine whether it was a new or established patient. Again, Congress now stepped in and said, no, we're expanding the benefit to include new patients. And then we created some new opportunities for using telehealth in different contexts. Typically, if you are recertifying a patient for hospice care, that's going to require a face-to-face encounter with the treating physician. Here now that we will permit those to be performed via telehealth. So it's an effective expansion on the list of available telehealth services. And then finally, beyond the COVID-19 emergency fund, Congress has provided HRSA with additional funding to continue its current telehealth programs through FY25. So we'll no longer be at the mercy of annual appropriations, whether those programs will continue. They are now solidified at their current funding rates through FY25. On the issue of pricing for COVID-19 tests, now COVID-2, the legislation addressed payment for COVID testing, but it did not address all types of testing. So again, CARES Act is coming through and making sure that it is very clear that all health plans, including Medicare and Medicaid, are required to cover all COVID-19 diagnostic tests without cost sharing. So it's now across the board. There have been some exceptions in there, some different types of tests. There were questions whether they would be covered. There's now an across the board designation that they will be covered and without cost sharing. Interestingly, there was some concern with the CARES Act as we began negotiating to get dollars available for hospitals to address and respond to the pandemic, whether Congress would see this as an opportunity to delve into the surprise billing issue. And in a very limited way, that does appear in the CARES Act, and that's with regard to pricing for COVID-19 tests. So a health plan is required to pay a provider for a COVID-19 test, either at the applicable negotiated rate in their current contracts, or if there is no negotiated rate, the payer is required to pay the provider's posted cash price. Posted cash price, you ask? Yes, there is a requirement in the CARES Act that providers must post on their website their cash price for different COVID-19 testing. And the failure to post that information on your website is the potential of a civil money penalty of up to $300 a day. So it's probably not on the top of your to-do list with everything going on, but some appreciation here that there is this requirement with regard to posting of those particular test price. But otherwise, there are no other provisions in the CARES Act with regard to surprise billing or transparency or similar provisions, which there had been some concern. Finally, the CARES Act provides significant new funding for federally qualified health centers with regard to COVID-related expenses. Earlier this month, there's an announcement that there would be $100 million going to our federally qualified health centers to address COVID-related expenses. There are about 1,400 health centers across the United States. They each receive between $50,000 and $320,000 for this purpose. The CARES Act includes $1.32 billion in this federal fiscal year, so to be distributed by the end of September. Dollars for FQHCs, again related to prevention, diagnosis, and treatment of COVID-19. If you do the math, that works out to just under $1 million per health center. So one can make the argument the FQHCs really shouldn't be applying for Marshall Act funds since they have these available funding now through these provisions. So that is a pretty, oh, one more, I apologize, missed this one. There are also provisions in the CARES Act with regard to access to post-acute care services. Again, the Section 1135 waivers, which were implemented beginning on March 13, included a number of provisions that were intended to expand hospital capacity by making it easier to place patients in post-acute care units or to utilize distinct care units. And again, last Wednesday, PYA sponsored a webinar reviewing those 1135 waivers in detail, also posted on our website. The most important of those were the waiver of the required 3-day hospitalization for a patient to be admitted into a skilled nursing facility. That has been waived under the Section 1135 waivers. But there were certain requirements that were waived under the legislation now, or at least they are temporarily taken out of place during the emergency. These were not available to CMS through the waiver authority. And so in the CARES Act, Congress addressed the inpatient rehab 3-hour rule, requiring that any patient that's in an inpatient rehab patient must receive generally at least 3 hours of therapy services, because we can now use inpatient rehab beds for acute care cases. There's now a waiver of that rule. They also are waiving the long-term care hospital site neutral payment policy, and thus providing a higher level of reimbursement for low acuity patients. They also waived the long-term care hospital 50% rule, which requires that at least 50% of patients are being paid on the LTCH PPS for the hospital to maintain its LTCH designation. That has also been waived, again, providing greater flexibility to move these patients as appropriate to different types of facilities. So there, sort of again, an overview of what's in the legislation. Clearly, the ability to secure advanced payments is going to be significant for cash flow issues. How we gain access to the $100 billion in the emergency fund, we'll be looking for regulations, we'll be looking for program guidance coming out of HHS on how those applications will be submitted and criteria for awards. We have at PYA developed a COVID-19 hub. We include there all of our webinar recordings, but not as well as the slides, the transcripts, and when we do follow-up Q&A. In fact, all the questions I've been seeing rolling through here on the screen, our job over the next couple of days is to get responses to those typed up, post those on the website. Again, also David and I and the other two PYA team are available by email to answer specific questions. We also post there our thought leadership. I made reference to the piece we posted on the Medicare advanced payment, but there also is a couple of excellent articles that talk about the SBA 7A loan program. And then we've provided links to what we believe are the most important resources that are available for you as you seek guidance. So we've given you the link to the website there. But otherwise, we look forward to providing more thought leadership, both in the form of webinars, printed materials, we are working our best to keep up with what's coming out of CMS, and we hope we can be your ally in accomplishing that. So thanks so much for spending the hour with us, and Laura, I'll let you wrap things up for us.
Thank you, and thanks to our presenters, Marty Ross and David McMillan. If you have any questions, their presentation and contact information will be emailed to you, along with a recording of today's webinar. Also, if PYA can provide assistance, please call or email us. You may also visit our website at pyapc.com for more details about our specific areas of expertise or to subscribe to receive PYA insights. On behalf of PYA, thank you for joining us and have a great rest of your day.